All right, welcome back. Welcome back to another lesson. Another lesson today. Class is in session. My name is Zach, and today's topic is pharmacology. I am going to say this, and what I'm going to say right now is what I say to you at this point in this slide, refer to your local protocol, refer to your regional protocol, refer to your state. Okay? It's for a reason because every state, every region, every area has different protocols, different standards, maybe similar, but things do change. Medicine changes. If medicine changes, protocols will change. All right, so let's get to work. I am going to share my screen. Today's topic is pharmacology. Pharmacology. So we got that going. Boom, 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 boom. All right, I hope your classes is doing well. If this is your first time doing a course, wherever you are. And if this is a refresher, well, welcome back. All right, welcome back. So here I am sharing. Let me go here and show my face a little bit. Boom, there it is. And let me hide this little thing here and wham. All right, let's get it going. Let's get it going. Let's get it going. Pharmacology. All right, pharmacology is an important topic because as an EMT, especially if you're new, we give drugs, we assist, and so you have to know this. We talked about medical legal, we talked about patient assessment. This is a very important aspect of it because now we have online medical control, as you said, talk to the doctor, and offline medical control, as we said earlier, is the protocols. And in the protocols, there are specific guidelines of certain medications. So we're going to go over some of the medications. So the pharmacology is the science of drugs. Now, drugs is used in many aspects to prevent certain things, pain, right? Treatments for certain things, ailments, and things like that. So there's specifics for prevention, treatment, and pain management. All right. So we all know we all have some exposure to a pharmacology in regards to drugs in our lifetime. If not, hey, that's good. But if you've been to a hospital, if you got oxygen, if you took aspirin before, if you had any of those things or took a pump before, if you have some respiratory problems, but it's all over. It's global. All right. So some of the terminologies you need to understand is the action. The action is basically when I take this specific drug, what is the therapeutic effect? What is it going to do for me? What is going to happen for me? All right. I will give you some examples, but the effect, the therapeutic effect. So, what is the action that's going to do for the best of me? Now, there are issues, there's situations where you have indications. All right. So, you have a patient that might have a drug overdose in opioids, right? So, there's a specific medication that you can administer. That's the indication. So, if they fit those criterias, then that's the reason for giving it, to make things or to reverse a specific adverse effect. A contraindication is, this is very important, a harmful a harmful effect. So if you gave, again, protocols is all over the place in numbers. If you gave, let's say, nitroglycerin to a patient with cardiac problems, but their blood pressure is below a certain number according to your region, according to your state, according to your protocols, and if they're below that number, that set number, then we cannot give it. It can cause adverse effect. All right. So that's a harmful thing. Contraindication, very important vocabulary word to know. And side effects. So there are also side effects. You have, let's say, albuterol was one medication. Then the effects of it, the reason I'm saying this because I know, because I take it as needed. And the effects for me is my heart starts elevating, rapid tremors and stuff like that. So most medications, some medications have a side effect, and some for might be more drastic than others, and some might be certain effects than other people. It depends on the reaction. This is golden. You need to know what this is. This is called the generic versus the trade. All right. Generic name versus the trade name. Super, super duper important. All right. So now you have two types of, let's say you have a drug, all right, one drug. And they ask, well, there is a generic brand and there's a trade brand, okay? Or is a generic and a trade. So what's the difference between the two? So here, very simple. If you look at the generic name, it's usually a simple chemical name of the drug. And sometimes we might not even know how to pronounce it. It's like a long name for the drug. So you might have, let's say one example is ibuprofen, but yet that's the chemical or the generic name of it. But their ibuprofen have different names, which we'll look at right next to that, is called a trade name. But the generic name is usually lowercase, is usually a long chemical name of the drug. Now, I'll give you my personal experience. Like for me, I grew up not with a silver spoon in my mouth. I grew up with a spork. A spork is when, hard times happen. So I never had the name brand sneakers. What I did, I had the Skips, if you know what I mean. Skips are just like no frills or that doesn't have a name. It's just a sneaker. That's the generic thing. Then as I got older, I started to make a little money and then I started to buy some name brand stuff. So the name brand, which is also known as the trade name, is the manufacturer brand name. So in this case, it will be Tylenol. Tylenol is a brand name that they own the name, right? So usually you have a capitalized letter. Usually you have the trademark of it, the little R with the little circle in it. So what do you do? Like sometimes I go to the doctor and I get some medications, and I first ask, "Hey, what's the generic? Do you have any generic? Same drug, but sometimes the name can boost up the cost of it. But if you get the chemical name of the drugs, it's doing pretty much the same thing. So get to know what this two words is: generic versus trade. All right, medication. So we go into the medication. We're going to go into the pharmacy or any of those department stores. So we have different names. You have prescription, prescribe. You go to the pharmacy, the pharmacist gives you prescription. The doctor gives you the prescription, they give it to the pharmacist, and they give you the medication. Then there's some other stuff like on this picture here. You have over the counter. All right, this is one of my regular pharmacies there. It's you go over the counter, you buy some of the basic stuff that's you don't need a particular prescription. Then there's recreational drugs, which is pretty much the illegal stuff. Then there's also vitamins, there's also herbal stuff. There are other types of names of medication. So it's not just one type, it's a very distant type. So when you have your patient, you got to really ask them what type of medications you're taking. Is it over the counter? Is it prescribed? Is it yours? Are you compliant? Things like that. Remember, I said before in patient assessment that you are an emergency medical technician. A technician fixes things, but you also have to be a detective and ask these specific questions. So let's look at the root. So now we have medicines, right? Now, how does these medicines get in our body? Very simple. So here we got the routes. So here we have the enteral. All right, look at the word enter, enter. So it's going to enter right in your mouth into your digestive system. So that's the route that you're going to go through the entrance. So that's going to be the mouth. The drugs will go into the mouth, the enteral medications. If you don't know which one is which, just think of the first 5 letters, ENTER. That's how it enters to the mouth, and it goes through the process all the way to the digestive system. All right. The parenteral is the medications enter by some other means besides the mouth. So it can go sublingual under the tongue. All right. It just dissolves under the tongue. It can go on your skin, a needle. All right. IV. So those are just the different routes. All right. Absorption. It goes, the process of the medication travels through your body tissues. It goes onto your skin, straight to the bloodstream. Very simple. PR, per rectal, which is rectum. There are medications that you can administer, I'm saying general sense, and that's a fast. What I have in the back at the ending of is fast, slow, or intermediate. So this is a fast action. Oral, PO, by mouth. It's a slower process because you have to go through the digestive system. It has to break down. Now, one of the fastest immediate ones is usually the IV. IV is into the veins immediately. Immediately. One time I went to get a procedure done, and I'm there, prepared for the surgery, and then the person puts the needle in, set it up, and then once the doctor came in, I was like, "Hey, doc, done." I was knocked out. It was immediate because it goes straight to your veins, and once from the veins, it goes straight to the heart. From the heart, it goes to the rest of the body. All right. IO is more of the bones. It goes immediate. All right. As BLS, we don't do this, but these are just routes that you need to kind of understand. Then we have the SC, the subcutaneous, which is beneath the skin, which is a slower process. Then we have IM, intramuscular, which is the into the muscles. Think of the word muscular muscles. It's a moderate, and there's some medication that we can administer or give to our patients. Inhalation's inhaling into the lungs, right? One of the known ones that we don't even think about is oxygen. Oxygen is one of those routes, which is inhalation. Sublingual is a picture here. I think I'm taking vitamin B. So the vitamin B is actually, no, that's something else. I think that's, yeah, B12. Here it is. So B12, I'll put it sublingual, and after, I don't need to chew it. I don't need to swallow it. It just dissolve under my tongue. All right. It's a rapid, it goes straight to the bloodstreams. Transcutaneous, which is the transdermal through the skin. It's a slower process. There's some medications we'll show a little later on. And last, the next one is the intranasal, IN, what goes into the nostrils. And this is a rapid one. This is kind of, it's not new, but in some areas it's been introduced maybe a couple of years, but is known as the Narcan, right? Mucosal atomizer device is one. Mucosal atomizer device is where it gets set up. I'll show you some pictures a little later on. All right, so we're gonna look at some of the capsules. We're gonna look at some tablets, solution, suspension, meter dose inhaler. As you see me there, that's my own personal one, and topical medications. All right. Transcutaneous medications. Remember, we spoke about that, and gels and gases in inhalation, like the normal breather, which is 15 liters per minute. And here we have the glucose, which is a gel. Again, I have all this on pictures. So capsule is a gelatin shell. Okay, it's a gelatin shell. It's full with either powder or liquid medication, and that gets dissolved as it goes into your digestive tract. Then you have the tablet. The tablet is pretty much material that are mixed in with medication, and it's like kind of compressed into that not capsule, but that tablet. So that's one type. So the picture down there you see, it's one with the green, that's the capsule, and the one that's white, that's the tablets. All right. Solution is a mixture, a liquid mixture of a substance. And usually that will be given through IV, IM. IV is what do you call it? Venous. IM is intramuscular, and subcutaneous injection. So those are solutions, is a liquid mixture of substance. Suspension. All right, suspension. Now, if you see if you can see, all right, in the upper right side, you see some powder, like black powder there. That's activated charcoal. All right, so suspension is a substance that does not dissolve well in liquid. Okay, it can be a ground of fine powder, which is what you see there in the picture, and eventually it distributes through the liquid by shaking and stirring. So with that substance, you have water and then the powder, and then you're gonna have to mix it up. This is known as activated charcoal. Okay, and there's some medications that have that substance that have to be added and shake, like some type of oral antibiotics, biotics. All right, this is here's an example of activated charcoal. This is the powder form, and I had a little water bottle, and then now put the water in the mixing with the powder, and you have voila, activated charcoal. And in some states and some regions, the patient will have to have fit certain criterias and have to ingest that. And what that does is to bind it. When I talk about overdose and poisoning, I can go more in details on that. All right, meter dose inhalers, the MDI, if you happen to see that on the test, that's what that means. It's a liquid of solids broken into very small enough droplets and particles that can be inhaled. All right, they call it the inhaler. So the meter dose inhaler is a device that most people will carry. Some are steroids and some are not. Some are just emergency base. But at the same time, it's usually deliver the same amount. Okay, the same amount. And some actual inhalers have like numbers, like how many times they have used it. All right, so meter dose inhaler, just remember that this is again another form. Then we have the topical, which is applying with skin surface, right? You have the lotion brand, you have the cream brand, you have the ointments. All right. These are just different examples of these types of topical on the direct skin. Transcutaneous is absorbed through the skin, aka transdermal, transdermal. One of the examples is a nitroglycerin paste. Now, as an EMT, when we talk about, or we probably heard of the cardiovascular, there are patients who might have the nitroglycerin paste. There are situations you might, in CPR, you have to put on gloves and you have to remove that nitroglycerin paste, because if you touch it, it's going to absorb to your skin, to your bloodstream, and then that effect can happen on you. So you become the patient. So if you touch the medication with your hands, you will absorb it just like the patient. All right. So just be careful when you're dealing with these types of medications, the transdermal gels. All right. We're not talking about hair gels, right? Obviously not for me, but gels. They are administered uh, capsules. There are actual plastic tubes, and generally they're used, they call them oral glucose for patients with diabetes, So with diabetes itself, that's one way of many ways of treating that. But this is one that you have, and that number that you see there, 15, that's 15 grams of glucose. Okay, glucose. And let's see, let me see, I have some pictures there. There's the glucose. There are many different brands out there. Excuse me, sorry about that phone. Uh, Lime flavor. We also have, you have to twist the cap. Then you twist the cap, and then now you have the gel form. So the gel forms like out there, and then you're going to place this in between here. Let me show you. Not sublingual, but just on the side of the cheek. It's called buccal, buccal. All right, so let's move on to the next. There it is. Perfect, perfect. The gases. So the gases is most commonly used for oxygen. Oxygen. So with oxygen, as you guys were introduced, we talked about the non-rebreather and the nasal cannula. Non-rebreather mask and nasal cannula. That's the gas. All right, the six rights. All right, is this the right medication for my patient? Is this the right dose? Is this the right patient? Is this the right route? That you have to figure out what it is, the route for this particular medications, and it's time. And you're going to have to document the time as well, because again, that EPCR or PCR has to be documented. And if you don't document these things, you never even gave the medication. So remember, we spoke about that term, documentation. All right, medication administration on the ambulance. Now, state by state, region by region, you know, state by state, region by in state. Yeah, I already said state by state. And oxygen, glucose, activated charcoal, aspirins, epinephrine, and Narcan. So look at your state procedures, policies, protocols, your region, and look into those and see what you carry on your ambulances or buses or trucks. All right. All right. So again, the State Department medical director will define the medications that you carry in your ambulance. So that's again. So look at your specific region and your state and see what you guys carry in that, or even country. So medications, oral medications, you have activated charcoal. We discussed that. That's the powder, the black powder. We also have oral glucose. Can you tell me where it's supposed to go? Correct. It is buccal. All right. And we have the aspirins. All right. And the aspirin that we're really talking about is, well, let's just make it aspirin for now. I'll show you what it is a little later on. And nitroglycerin is another factor. So we're going to look at some of those. So intramuscular here is epinephrine. All right. This is usually a release of histamines. Well, allergens are the ones that actually causes this, is an exposure. And then from there, it causes a severe reaction. And most patients will carry this. They'll be prescribed. There are actually different types of auto injectors out there. I just gave you one example. And so epinephrine, it reacts to the antidote, all right, the auto injector. All right, as you see on the left side, it's one type, two different colors. You have the yellow, which is the container. It goes through the EpiPen. Then notice here it was kind of broken out or broken apart. You got the spring, the medication. It's a one type dose. Okay. There's a dose for pediatrics and there's a dose for adult. So again, all intramuscular IM. So if you see IM as maybe your tests, that's what they're really talking about. If you look at the word intramuscular, see the bold dark, it's there. All right, so this is just one example. All right, you have the blue and the orange. So blue is always the sky. What do they say? They said blue sky, orange thigh, and to be administered to that. So there's a safety part over here. All right, remove that. Go to the specific site, and then there's the needle that goes through the muscles, which is called intramuscular. All right, with more details, we go into allergic reactions. Now we have intranasal medications, or IM. Naloxone, this is one of the biggest topics, hottest topics for years. All right. One point when I started, we never administered this. It was always the paramedics. However, as this really huge issue across the nation, now they start to even have people, civilians, starting to administer this type of medications, the opioid overdoses. So here we have the different pieces. We have the medication. This is the valve. This is the MAD, the mucosal atomizer device. This is where it goes. It goes right into the nostril, intranasal nose. All right, it gets set up, and depending on the patient, again, your protocols on your state or regional, you have to look at those numbers and the dosage, and you will administer that to the patient, and that's what it will look like there. Inhalation medications, we discussed that earlier before, the non-rebreather versus the nasal cannula. Again, that's how we do that medication through inhalation. Inhalation, again, we're looking at the, remember, MDI, meter dose inhaler, and we also have the nebulizer. All right, so the liquid turns into mist or spray. All right, it's a fast absorption and it's definitely portable. People have this, I have this as well as needed. And some of the crews, depending on your state and regional, you will have perhaps this or something like this. All right, so let's look at the inhalation medication. So here it is, a meter dose inhaler. And you see in the middle, I think this is where all the numbers, it shows you how many pumps you gave. This is a setup of a nebulizer. You have the tube. This is the mouthpiece, the T-tube, the cover, and the medications go here. This is what it'll look like. You just set this up, the canister to the T-tube, and then you can have the patient hold on to this. And this is the oxygen tubing, and then you have the medications based on your protocol. Oh, sorry about that. Based on the protocol, you can administer what it is, and look at that. It goes inside here. That's a liquid. And then from there, it will start to change to a mist. This is another type known as the BAND, the breath actuated nebulizer. And usually you see some of these in the hospital. They're just showing some different types. Inhaler, you also have a thing for pediatrics. This is known as the spacer. I had this when I was young. Basically with that spacer is this. This is the spacer. It's still the same pump. This is a spacer. This is the mouthpiece. So basically insert this mouthpiece inside here. Then you're going to spray it and the medication is still hanging out. But once that patient is able to inhale, that medication gets pulled in and then voila, it works. All right. This is preventing from when like pediatric patients, usually when they use the regular pump, sometimes the medication escapes, goes here, there, everywhere. But with the spacer, it helps more of a seal and giving as much medications for this patient. Okay, so the patient sprays the dose into the chamber and then they inhale from there. And that's it. All right, very simple, very, very simple one, pharmacology. Again, if you have enjoyed or you got something out of it or if you missed something, you can always rewind, stop. All right. And again, there are many different textbooks out there, many awesome instructors out there. And I'm just showing you one way of kind of breaking some stuff. And so keep studying, keep going forward, share it with someone, your classmates. That will help you just to know the basic stuff. I try to keep this as simple as possible. All right, until the next presentation, have a good one. Keep studying and continue to be the best soon to be EMT. And if you guys are refreshers, you are EMT, you are the best. Continue to make a difference in people's lives and be safe out there. All right, have a good one. See you then.